Hi, everybody. This is Mark again. I am from the Green Party of Allegheny County. We are posting these for anybody. I don't care what your political background is. I'm in public health. I'm a part-time student working on my master's right now. And I've worked in infectious disease labs for about 10 years. Pandemics and infections, infectious diseases are what I really enjoy, and I've really looked into previous pandemics, and you'll see that I'm touching my face and touching my nose, and it's fine. I haven't been outside my house in a few days. I don't have to keep washing my hands because I'm not going outside and potentially picking up the virus itself. So I wanted to let everybody know before you say you're touching your face. You can do that. Matter of fact, I feel like what you can and cannot do has not been really explained well in the media. And I'm going to try to break some things down for you because the isolation isn't as bad as people think it will be. But I'm an introvert, so maybe for extroverts it really is that bad. But here's ways to prevent others from getting sick and basically why we do it and what the logic behind it is. So again, cover your cough. This prevents air droplets. And what air droplets are is basically when you sneeze, when you see the mist, the spray coming out of your mouth, those are air droplets. That's not the definition of airborne, and I sort of wanted to clarify that a bit. Measles, for example, is an airborne virus. If somebody sneezes on the subway or in an area, if there's no real wind disturbance, somebody, say the subway area, anybody that walks through that cloud that somebody sneezed into for the next 2 or 3 hours will become sick with measles. That's not true of the coronavirus. The coronavirus is not airborne. It's too heavy to stay up in the air. It clings to the air droplets. But obviously, if somebody gives it energy by sneezing into the air, it'll be out there in the air. And if you're in that vicinity, breathing while, through your nose and mouth or whatever, while the air droplets are there, if you're within 6 feet of them, you can potentially become infected with coronavirus. So it's not as scary as it seems. It's a lot of from what I'm hearing, a lot of the infections are coming actually through your hands by touching infected surfaces and then touching your face, which is what you want to try to avoid when you're outside. If I have to go to work, I get on the bus and my hands I consider contaminated until I wash my hands thoroughly, and that's 20 seconds of lathering really well, wrists, full hands, and then you'll be fine. I wouldn't recommend touching your face outside anyway, but just so you know how the virus is working. So we also have, actually, for cover your cough, the CDC recommended way is to cough into your elbow like that, and all the air droplets are now on your elbow. Now, if anybody touches that area, obviously they're going to have it on their hands. If they touch their face, they can still get sick. So you want to, my battery's low. Hold on 1 second. Why is my battery low? I'm plugged in. All right. So, where was I? Oh, so I'm still not plugged in. What the hell? Sorry, everyone. Technical difficulty. All right. So, where were we? Stay 6 feet apart. Yeah. Again, 6 feet apart. That's that's also the distance that the air droplets cannot travel. If you're standing 6 feet from somebody, I wouldn't recommend standing 6 feet from somebody and testing it and having them sneeze if they have coronavirus. But the standard rule is 6 feet apart. Somebody actually was getting off an elevator the other day and coughed, didn't cover their cough, and started walking off the elevator. Same elevator I was going to take upstairs, and I walked the other way, and I took another set of elevators because you don't know. 80% of people are asymptomatic, meaning they don't show any signs, or they show very mild. They might think they have allergies or a mild cold. Most people do not get very sick from this, but are still able to pass this on to other people. This is why we just assume you're infected. That's what we do in infectious diseases. Always assume that you're contagious. So if you're contagious, you sneeze into your elbow. I always sneeze into my shirt. It prevents the air droplets from getting out and potentially infecting anybody else. So keep yourself safe and keep others safe by doing that. So social isolation. Number 3. I don't even know if this can show up well, but whatever. So social isolation, where you stay at home, you don't mingle with anybody. So why they're closing schools, why they're closing work. This obviously is to help with the 6-foot rule. You won't obviously become infected if you're not around anybody that has coronavirus. I've heard actually people that, their kids are home from school, they're making play dates. Don't do that. You do not want to mingle with anybody else. Always assume the other people are infected. It's a basic safety mechanism to prevent coronavirus. And when they say isolate, social isolation, it doesn't mean you can't go outside. If you have a beautiful backyard where you can grill out and sit out with your wife or husband or family, you can do that. You don't have to sit in your house. You just do not want to approach anybody or come within 6 feet of the mailman or whoever is out there, or you do not invite your neighbors over for steaks on the grill. You don't want to do that. The whole point is to stay a good distance away. You yell to somebody over the fence, if it's your neighbor, just don't get close, no contact. But social isolation is not sitting in your house, just, sitting there watching TV for, however many weeks this is going to be. Again, like we said, 80% of people are asymptomatic, but still spread it. This is the big problem we're having. We can't detect when people are sick. Actually, the tests are an issue right now. I was just watching a live stream today about doctors still having an issue getting the tests to test people. But they expect for it to loosen up a bit today. So we don't really have an accurate count of how many people are infected out there. So assume it's widespread. Assume that you need to stay home, because our numbers a few days ago were like Italy a week ago, and this thing is exponential. Exponential growth means it keeps doubling every, I think it's 2.5 days in this case. And very soon it's going to overwhelm our healthcare system. And I will go into more detail on that in another video. Thanks for watching. If you have any questions, I don't know where this is going to be posted yet. Probably our Green Party website page. If you have any questions, leave questions and I will try to answer them. Thanks.